I am a living testimony. I could have been dead and gone, but Lord, you let me live on.
Without this program, I might not have gotten treatment.
They are benefiting us. Oh, are they benefiting us?
I really wish all women knew about our program.
Still alive.
From the very beginning, this program, was challenged to find, a way to work directly with states and administer a complicated program that also meant that they had to identify women who were eligible for screening and get that apparatus into place.
We started to see women screened, which was amazing. We saw states got their programs implemented, started screening women, and what was so exciting was we really were reaching those women that were underserved.
Particularly when the program was matched up to the state and federal Medicaid program, it meant that people not only were able to get screened, but then if they tested positive for cancer, they had a assured source of treatment, and that's huge.
We're all working towards the same thing, is getting low-income women with little or no health insurance or inadequate health insurance into the program to be able to get them screened.
Finding the BCC program was really a lifeline for me. At that time, being uninsured, no money, not even a job, and my husband out of work, it was really tough to imagine that I could get treatment for cancer. I had no resources.
It was a team of them I had of people that didn't like cancer. And they went after, like I say, with the tenacity of a pit bull. So you need people like this on your side when you're going through something.
Without this program, I might not have gotten treatment. And if I had gotten treatment, it would have been very costly for me. And it really would have affected me in a negative way the rest of my life. Instead, I was given this miracle that, I really wish all women knew about our program.
We started a tribal program. And the reason for that was that the state health agencies weren't as successful in terms of reaching out to American Indian and Alaska Native women. And so that was another very big success for us.
There was no screening available like 10, 15 years ago. And we have lots of community members that come forward to, and tell us their story about losing their loved ones. And they wish that the program was there at that time when they lost their mom otherwise, and they're very supportive.
The National Breast and Cervical Cancer Early Detection Program is at a crossroads right now. And it has a tremendous opportunity with the Affordable Care Act to really serve as a model for how we deliver clinical preventive services in this country. The program has worked for the last 20 years to perfect a process of working with the healthcare system to ensure the delivery of cancer screening services and outreach to the public to build demand for those services.
Over the past 20 years, the National Breast and Cervical Cancer Early Detection Program has built an infrastructure around the country, not just screening, but quality improvement, patient navigation, case management, and all of these things will be important, probably more important, as more people become insured under health reform.
There's going to be 32 million more people who will have access to insurance that don't have it now, but nothing else changes about them. They still need to know that they need screening. They still need to have the fears they have about screening addressed. They still need to have their barriers such as transportation and language barriers addressed and so on. So when it comes to the future, I think the role would be much bigger. It's just that we will be doing our work differently than we do it right now.
Just to talk to one person whose life may have been saved because of the fact that they were screened through this program and that where they had cancer, they were able to access treatment. And to me, that's the ultimate value of it all. And I'm just very proud to be a part of it.
Oh, I'm a living testimony, and every day I thank the Lord that I'm still alive.
Finding the BCC program was really a lifeline for me. At that time, being uninsured, no money, not even a job, and my husband out of work, it was really tough to imagine that I could get treatment for cancer.
My husband was gone at that particular time, a few years, and not having him there made me feel like sometimes I was by myself. So I had to tell myself, you're not by yourself. You got these people in this organization with you.
They walked me through the whole process and told me everything that was going to happen and how I would handle it, and they were really there for me at a very important time.
It was a team of them I had, of people that didn't like cancer. And they went after, like I say, with the tenacity of a pit bull. So you need people like this on your side when you're going through something.
Without this program, I might not have gotten treatment. And if I had gotten treatment, it would have been very costly for me. And it really would have affected me in a negative way the rest of my life. Instead, I was given this miracle that, I really wish all women knew about our program.